Nephrotic syndrome is a common kidney disease. Protein deficiency in urine, decreased protein content in the blood, high levels of cholesterol, and inflammation in the body are the symptoms of this disease. Due to this disease of the kidneys, swelling can occur in the body at any age, but mainly this disease is seen in children. With proper treatment, control of the disease and subsequent reswelling is seen. This is a characteristic of nephrotic syndrome, lasting for years. Due to repeated swelling for a long time, this disease is a worrying disease for the patient and his family members. In simple language, it can be said that kidney acts as a sieve in the body, through which the excess substances of the body gets excreted by urine. In nephrotic syndrome, due to enlargement of hole like kidney filter, the extra water and excretory substances as well as the protein required by the body are released along with the urine, which reduces the amount of protein in the body and swelling in the body. There is a decrease or increase in the swelling of the body of the patient according to the amount of protein that passes the urine. Even after inflammation in the nephrotic syndrome, the kidney's functionality to remove unnecessary substances remains unchanged. That is, the chances of kidney failure are little low, but it can surely happen. So what causes nephrotic syndrome? No definite causes of nephrotic syndrome has been found. There is a belief that the disease occurs due to autoimmune disease deficiency. Changing diet or taking medicines is not responsible for this disease. 90% of the patients of this disease are children, in whom no definite cause of nephrotic syndrome is found. It's also called primary nephrotic syndrome. The primary nephrotic syndrome can be caused by different pathological disease. The primary nephrotic syndrome is a specialized diagnosis that is diagnosed only after the removal of secondary cause one by one. In less than 10% of its cases, nephrotic syndrome can be caused by different disease, such as infection, loss due to any medicine, cancer, hereditary diseases, diabetes, and amyloidosis. Nephrotic syndrome is an important cause of recurrent inflammation in the children. Minimal chain disease is the most common cause of nephrotic syndrome in children. The disease occurs without a cause in 35% of young children up to the age of 6. In this, blood pressure remains normal in the patient and red blood cell, absent of urine and serum creatinine are normal too. The main symptoms of nephrotic syndromes are as below. The disease mainly occurs in children between 2 and 6 years. The number of individuals of other ages appears to be much lower than children. The disease usually starts with a fever and a cough. The typical amount of the onset of the disease are swelling under the eyes and on the face. Due to swelling on the eyes, many times patients first go to the eye doctor for an examination. This swelling is more visible when the patients wake up in the morning after the sleeping, which is the hallmark of this disease. This swelling starts to decrease gradually as the day progresses and subsides completely by the evening. When the disease progresses, the stomach becomes bloated, urine is reduced, and the whole body starts swelling and the weight gets increases. Many times, there is a complaint of foamy appearance in the urine and white spots appear on the places where urine has been urinated. In this disease, there are no symptoms like red urine, breathlessness, or increased blood pressure. So did you see how this dangerous nephrotic syndrome can cause your children's harm? To avoid a severe disease like this, you and your kids needs to consult a doctor from Ayurveda. Ayurveda has been treating patients with chronic kidney problems for many decades. Here Dr. Puneet Dhawan treats many kidney patients on a daily basis. Let's go ahead and meet a patient.
Ji, what's the patient name?
Nazma Sultana, she's my mom.
She's your mother. And
Yeah.
you're coming from where?
I'm actually from Assam.
Okay.
From Assam.
Where in Assam?
It's nearby Guwahati. It's a town called Gwalpara.
Kolpara.
Yeah.
Where in Kolpara?
It's in the main Gwalpara town itself.
Okay. You are staying there.
Yeah, my parents are staying there. I live in Delhi.
You live in Delhi.
Yeah.
Okay. So, what was the position when you started the treatment at about 3 months back?
Actually, my mom, she had a high level of creatinine. So initially it was somewhere around 4. But after taking out treatment for the last 3 months, it's come down to 2 right now.
Okay. The
So
creatinine level is right now?
Right now it's 2.
Okay.
So I feel it's got like it's actually like it's showing some effect. Not some effect, it's showing a lot of effect actually.
Okay. So this is considered to be a progressive disease. First of all, earlier the creatinine level was increasing day by day.
Yeah.
And right now it's not increasing, and
Yeah.
as well as it is come down.
Yeah, it's come down right now.
Okay. So how is she physically right now?
She's physically fine, and moreover, apart from the medicine, it's also about the diet you suggested us to
Diet
follow.
you're following.
Yeah, the diet also is actually very good.
Okay.
So I think that's one more. It's like a boost
Okay.
to your medicines.
Okay. So any kind of breathlessness is there or something like that?
No,
She's fine with that.
She's fine.
Any
with that.
nausea or vomiting?
No, nothing like that. Nothing.
She's
like that.
perfect.
She's perfect right now.
Okay. So she's doing all her day-to-day activities.
Yeah, she's fine right now.
She's fine.
Like compared to before, compared to when she started taking her medicines, right now it's like pretty good.
Okay.
But,
Good.
no, yeah,
And
her levels have come down.
Calm down.
Did you see how the magic of Karma Ayurveda treated these patients' chronic kidney problems with ease? We hope you like this video. Please don't forget to like, share, comment and subscribe. See you in the next video. Stay healthy, stay happy.